Well, good evening and welcome to EBN Weekend Edition. It being the first day of December, the year 2023. Indeed, the festive season is here. Now, a lot has happened. Today being the World AIDS Day, well, 57% of people living with HIV and AIDS in the country are said to be from 10 counties. Well, raising questions of what are some of the interventions the government is putting in place in order to make sure that the number is reduced to a manageable one and one that the country can handle. Now, those are some of the questions that were raised today in Meru County during, or rather where the CS of Health, Susan Nakhumicha, was leading the country in marking World AIDS Day. And also on matters politics, Odinga today was in Kakamega County in a bid to popularize his ODM party. Well, we shall be taking a look on that and many more later on. But remember, my name is Sami Adika, and get in touch with us through our socials at EBN TV and at Sami Adika. Now, starting us off tonight, according to the 2023 report by the National Syndemic Diseases Control Council, Kisumu County is said to be leading in the population of persons living with HIV and AIDS, followed by Nairobi, Homa Bay, Siaya, and Migori counties, which form the top 5 counties with the highest burden of HIV and AIDS in the country. Speaking during the commemoration event of World AIDS Day in Meru County, Health CS Susan Nakhumicha said that there is need to put in place necessary measures to combat stigma and discrimination to support efforts made in reducing HIV infections and deaths in the country.
And you know, as we celebrate, at times people do not know exactly what it is that we are celebrating. In Kenya, we have over 1.4 million who are living with HIV. But the good story about it is that out of this, close to 96% are on treatment. And that is how we are managing to ensure that this does not spread further.
As a county, we are also committed to fostering the government's commitment to ending HIV in children by 2027. This goal calls for a strategic approach that focuses on enhancing antenatal care, expanding access to HIV testing, and treatment for expectant women.
HIV is with us. HIV is real. HIV is a killer, but you can live a full life, total full life. You can contribute to the society. You can contribute to your families. You can reach your highest goals even if you've got HIV.
We need to also extend love and compassion for our loved ones, our friends who are managing this condition. In most cases, most people who succumb to this condition is basically about mental health. Because you find that when we go through the diagnosis, someone will just thought that I'm not going to take medication, or I am not going to take care of myself, or I'm not going alone. So mental health becomes very, very crucial as much as management of this condition.
People living with HIV and community health workers play a pivotal role in driving and enhancing HIV response, as well as global health at large. Communities connect people with person-centered public health services, build trust, innovate, monitor implementation of policies and services, and hold health providers accountable. There was an estimated 39 million people living with HIV at the end of 2022, 2/3 of whom are in African region. We are talking of 26.5 million people in Africa. Coming closer home, about 1.3 million people in Kenya by the year 2023. 1.3 million people are not few. People living with HIV, 1,02,994,339 in 2022, out of which 89% are using 89% have actually managed to suppress their viral load by using the ARVs.
Well, now moving to the coastal part of the country, controversial preacher Paul Mackenzie has been sentenced to jail for 12 months for the offense of operating a filming studio and producing films without valid license. Malindi Senior Resident Magistrate Olga Onalo also slapped Mackenzie with another 6-month jail term for being in possession and exhibition of films to the public through Times TV without an operating license, and the sentences will run concurrently. This is after the probation office recommended that Mackenzie be denied, or rather be denied, an alternative of the fine.
In respect to the charge of possession and exhibition, the Defense Counsel in mitigation stated that the accused had been charged with a similar offense, thereby making him a repeat offender. That, however, the said offense may not have been intentional. This cannot be the case, for once the accused person had been charged, that was information enough to him that he was running against the law, and he ought to have refrained from the same. In light of the foregoing, in respect to count 2, I hereby sentence the accused person to 12 months imprisonment, while in respect to count 3, the accused person's explanation of not knowing the need for a license from the Film Classification Board, having obtained a broadcasting one, is a reasonable, though not entirely acceptable, as ignorance of the law is no defense, hence the resulting conviction. And in light of the same, I sentence the accused to 6 months imprisonment. The sentences shall run concurrently.
Well, that is quite interesting right there, considering the jail term period. Many are questioning, especially online, whether Mackenzie should be given 1 year or more. But then that belongs, or rather is the mandate of the judge to decide. Now, on matters politics, Azimio la Umoja party leader Raila Odinga has condemned the ongoing demolitions in Milimani area, Kakamega County. Odinga faulted the government for initiating the project in the area without public participation. Milimani residents have lost their houses to pave way for the government's affordable housing project that was commissioned by President William Ruto in September this year.
Na serikali inakuja tena, inakuja usiku. Usiku ni wachawi ndio wanatembea usiku. Kama wewe unakuja kufanya kitendo cha halali, unakuja mchana, unakuja na makaratasi yako, unamkabidhi yule ambaye yuko pale, unasema sisi tumepea amri kuja kubomoa. Mimi nimebomoa manyumba ya watu nilipokuwa waziri wa barabara na ujenzi, lakini ilikuwa inafanyika mchana. Tena nilikuwa nimewaambia maofisa pale waende kule wamuonyeshe kila mtu notice imetoka kwa serikali. Kwa sababu gani tulikuwa tunafanya kitendo kama hicho? Sasa kama serikali nasema unataka kujenga manyumba kwa watu na unabomoa manyumba ya watu wengine, sasa hiyo ni kazi gani hiyo? Si kazi bure hiyo? Kazi bure sana. Sio ati wewe ulazimisha mtu ati mpaka aende kwa ile manyumba wewe umejenga. Juzi mahakama ilisema hii kodi ya manyumba ambayo wamelileta ni sio halali, ni kinyume cha katiba, lakini bado wanazidi kufanya vitendo kama haya hapa. Sisi tunasema hii tunalaani vikali. Tunalani vikali sana sana sana. Na vile umesema waenda kwa mahakama wafanye kazi yake. Lakini sisi tunasema maneno mengine baadaye juu ya hii mambo kama imefanyika hapa siku ya leo. Tunasema wale wote ambao wameathirika hapa, poleni sana. Sisi tuko na nyinyi pamoja. Na huyo mjane ambaye nyumba yake imebomolewa, sisi tutapatia hiyo mchango.
Now, traders at the famous Gikomba market are counting losses of unknown value after fire gutted part of it. Now, the fire engulfed Section 42 in Majengo, causing extensive damage. Fanuel Juma, the chairman of shoe traders in the affected Gikomba market, reported losses running into millions of shillings. Gikomba market has suffered numerous fires, with the most recent being in September this year. Now, the fire comes just days after Nairobi County government announced plans to commence the construction of the long-awaited Gikomba and Kangemi fire stations that seeks to reduce or combat fire cases in that famous market.
Mimi nilipigiwa simu na watchman wangu saa 8 usiku. Akaniambia moto umeanzia kutoka upande wa kule tunaita 42 ikielekea hivi. Na mimi nikakuja. Lakini nafikiri ni kama ilikuwa imewekwa kitu kwa sababu ilikuwa inatembea sana. Mimi naishi Buruburu, kutoka Buruburu kufika hapa nilikuta moto ikiwa kwa hizo mastore hapa. Serikali kubwa na county, kwanza ya county ni itengeze barabara. Ndio magari ya moto inapata nafasi ya kuingia. Kama sasa gari ya moto kuingia hapa ni shida. Hiyo ndio ile shida tuko nayo. Hiyo ni county. Serikali kubwa ni hata county, unajua sasa si tunawekera Januari wakati wanakuja kulipisha watu ma license sijui nini. Wasikuje.
Kuna watu waliumia, kuna kadhaa waliumia juu hapa, pia kuna watu wengine wameishi ma rentals, kuna watu waliumia juu hiyo kusmoke queen hell hiyo moshi, kuna watu waliumia pia kurash juu ya moto. Watu waliumia, si hakuna watu wa kuumia, watu waliumia.
Mimi nilipoamka asubuhi nilipata simu, nikafungua. Baada ya kufungua simu huyo dada alinipigia akaniambia Gikomba kote kumechomeka. Nikamwambia wapi, akaniambia kwenye viatu. Nikasema Mungu wangu, naenda kuanzia wapi na maisha yangu jinsi yalivyo. Nikiwa nafikiria hivyo nikaja nikafika hapa Gikomba. Nilipofika nikaona tukio la moto jinsi lilivyokuwa. Nikaanza kulia. Mimi sikuweza kufanya kitu chochote, nikaanza tu kulia. Ndio kitu nikasema sasa viatu vimeisha, sina mwelekeo, sina nini. Nikarudi nyumbani nikaenda kulala. Sasa hivi ndio nimepigiwa simu tena nikaambiwa mzigo, kuna mzigo ameona jina kama ni langu. Baada kufika hapo jina lilikuwa limeandikwa Mama Gifti na mimi naitwa Mama Chifu. Nikaangalia nikaona majina yalikuwa different.
Well, now on matters education, the Kenya Union of Post-Primary Education Teachers, KUPPET, has threatened to down tools come January if the government fails to employ junior secondary school teachers who are currently on internship contracts on permanent and pensionable terms. The junior secondary school intern teachers who had been posted in various institutions across the capital city have also threatened to camp outside TSC headquarters demanding for permanent and pensionable employment, as their contracts will be expiring by the end of this month of December.
We are here to give our stand as far as Nairobi is concerned. Is that clear? Yes.
We got shocked when we heard from the Commission that it was planning to renew our contract. We are saying that we are not going to renew that contract. It is against the law, and the stipend that we are being given is too little to sustain us in this economy.
We are very categorical that if our contracts will not be transformed into permanent and pensionable, come next week everybody that is teaching in the junior secondary school will be on the street. And there is a confirmation, and parents must be aware that nobody will be in charge, nobody will be teaching their children come next year 2024. We want to tell TSC that please don't play with the children of Kenya. They will suffer. Imagine of a situation, you are sending a demoralized teacher to teach a Kenyan child. What do you expect?
They were given letters telling them that they were going to serve as interns for 1 year. Unfortunately, 1 year is over. Now they are being told that their contract will be renewed. We are telling the government, those teachers, if you come to January, we are ready. We are going to urge all our colleagues to stand in solidarity with the JSS teachers that they must be turned to permanent and pensionable.
Well, it seems that teachers have a lot of demands that they want the government to address, it not just being employment on permanent basis, but also infrastructure in junior secondary schools across the country. We're waiting to see how the Ministry of Education will work towards ensuring that such cases, or rather such issues, are properly addressed. Now, on matters health, the Kenya National Union of Clinical Officers has raised a red flag over an increase in assault cases targeting health workers across the country. Now, the health workers now want legislators in the country to formulate laws that will allow armed police officers to guard all major health centers. Now, this comes after an incident in Naivasha Sub-County Hospital over the weekend where a group of relatives clashed with some medics over the death of their kin.
It is very disturbing and concerning that right now the health workers here are working with a lot of fear. Fear from an incident that happened on Sunday when, as they were managing their patients, as they always do, as they normally do, then some relatives came in threatening, battering and attacking our members. In fact, even if the medics, because they were trying to resuscitate and save that patient's life, it is even very possible that somebody can make them to even to not do what they are supposed to do, and the patient loses the life. We are also disturbed by the fact that the police were informed,
and that's why you normally say that bricks and mortars is not final until you have the requisite trained professionals who can offer services here. And I've seen the queue here is very long, and most of the consultation rooms are empty. No one is there to see patients. So those are actually also issues that can push some people who are a patient, or those who have escorted patient, to feel impatient because they are waiting for longer, and we are exposing this.
Well, still on matters health, Kenya Medical Practitioners and Dentists Union, KMPDU, Kajiado branch has given a 7-day ultimatum notice for what they term as being neglected and denied their right by the county government. The union says qualified individuals have not been given a promotion and a salary increase despite their qualifications. Now, KMPDU Secretary General Davji Atela has noted that the Ministry of Health has failed to fulfill its promises, and it's time for the medics to act.
Solidarity forever, solidarity forever.
Hata hofu yenyewe huwa inatuhofia. Kwa hivyo hatuwezi sema kuwa tunaweza tisika juu ya CC ama juu ya board ama county government, hatuwezi tisha nayo. Kwa sababu ndio maana tunasema hii nchi kuna sheria na lazima sheria ifuatiliwe. Tunao madaktari wa county wa Kajiado ambao wanakuwa victimized, na hiyo ni kutokana na hiyo victimized tunaona kuwa hakuna goodwill. Ndio maana daktari mmoja akishikiliwa ama akitendewa kitendo cha kinyama, ni daktari wote nchini wametendewa. Ndio maana tumetoka Nairobi kuja kusimama na madaktari wa Kajiado kuambia kuwa lazima county tekeleze zile ambao tunaita ni rights zao.
We've talked about the issue of promotion in Kajiado, whereby there is the issue of favoritism, there is the issue of clanism, and the issue of tribalism. Those are the issues affecting promotions in Kajiado. So if you don't come from the same clan with people in public service board, be assured that you are not going to be promoted. And there are also the issue of tribalism, that if you are not a native of this place, and you don't know someone in the public service board, you are not going to be promoted.
Well, away from matters health, the Law Society of Kenya conducted an operation earlier in the day in Kangema and Kenol Murang'a County in a bid to fish out individuals masquerading as advocates. Speaking during the operation, Stephen Bogwa, an advocate from LSK headquarters, noted that such individuals have been duping the public, and some of the documents they prepare, such as sale agreements, hold no weight, and members of the public have lost matters before courts as well as their money. Now, Mbugua urged members of the public to be vigilant and always confirm the authenticity of those offering them legal services by checking licenses or their registration by LSK.
It is Wanjiko who gives us this information, and then
Well, now crossing over to Kakamega County, Roads and Transport Cabinet Secretary Kipchumba Murkomen has warned the universities about relying too much on communities and areas, stressing that these trends have led to the collapse of many educational institutions in the country. Now, speaking during the graduation ceremony at Masinde Muliro University of Science and Technology in Kakamega County, Murkomen said that all colleges in the country should adhere to international standards, warning against local policies that contribute to acts of corruption and ultimately undermine the value and integrity of the institutions.
Please continue the trajectory of connecting the university and marketplace. There must be a close connection between the university and the industry, because that is extremely important. We don't want important universities where students are actually studying theoretically, and yet they are studying science and things that should be practical. Let's do everything to ensure, and the council supporting you, to make sure that there is a link between the university and industry. Let us avoid localizing our university. MUST is not a university for Kakamega, and it's not a Luya university. This is an international university. Also, is international. Let us stop localizing our university. The disease that has really killed most of our universities as a country is making it local and capturing it with corruption, with ethnic capture, wastage, that has made it impossible for the universities to grow.
We'll have a challenge in doing so, but it's a conversation we must begin. And as you all graduate, especially the PhD students who are graduating today, we need to have a conversation on what will education look like in 2028. That's what we need to be discussing. How do we frame, organize, strategize to make sure that the future generation remembers us, just like the way we remember our forefathers, remembers us for doing something that actually delivered to the betterment of our society.
To satisfy our interests, then you can look for your interests. And I always tell them, Vice Chancellor has got one objective, and he has an interest. The interest to see you people, the students, go out and do the needful. Money is not my interest.
And in Nyanza region, early childhood mortality in the Luo Nyanza region is alarming despite heightened efforts to improve child and maternal health. Data from the Kenya Demographic and Health Survey 2022 shows that Migori County has the highest number of infant mortality at 53 deaths per 1,000 live births. Kisumu recorded the least number of 40 deaths per 1,000 live births. Consolata Chibalonza with the report.
Speaking during the KDHS Dissemination Forum held in Kisumu County on Thursday, Godfrey Otieno, KNBS official, said the report has brought to light significant milestones in health indicators and identified areas that require urgent intervention in the region.
We also have a number of health indicators where we have also not done so well. This includes child health. Even though we are slightly above the national average in some cases, in others we are below the national average, but there is still room for improvement, as we have seen. The area of gender-based violence also, we have also seen that there are some issues in Kisumu, but not as compared to the neighboring counties of Homa Bay, where we had very high prevalence of gender-based violence. Kisumu is a little bit low compared to Homa Bay, as we have seen, but it is also below the national average. Well, the other indicators which we have also seen we are doing well is on the use of contraceptive. Kisumu is doing well, and the indicators are very high compared to its peers, even for the national average.
Kisumu County Medical Services Director Dr. Don Ogola reiterated the county's commitment to use the findings in shaping policy decisions, programs, and interventions to enhance health outcomes. Dr. Ogola emphasized the role of community health providers that has been engaged to enhance the healthcare system, leading to reduced mortality rates in the lakeside counties.
And what are we doing about this? We are doing what we call capacity building and also performance appraisal and performance contract reward to our CHP, so that they can catch or get women who are pregnant first in time, so that we are not talking about the 4 antenatal visits, but now we want it to go to 8 antenatal visits, which is recommended by WHO. You find that in Kisumu, the first ANC is very high. However, the 4th ANC visit is low. This means that whenever our women go to the hospital for the first antenatal clinic, then they forget about the subsequent visit. And you know that the outcome depends on when and how you are managed on this during that period. You find that in our strategic plan as Kisumu County, with our governor, with his good manifesto that we want to reduce this, our first objective in the strategic plan is to eliminate any communicable diseases. And you find that the under 5 mortality we are talking about, the main cause is pneumonia, which is a communicable disease. And you're working so hard to increase the vaccination coverage, which we are also performing a little bit below the average, so that we can reduce, because the only way to reduce the communicable diseases is to increase on your immunization, so that those who don't get the immunization may have the advantages of herd immunity.
KDHS 2022 was implemented by the Kenya National Bureau of Statistics in collaboration with the Health Ministry and other stakeholders through funding from the United States Agency for International Development, the Bill and Melinda Gates Foundation, and the World Bank. Other implementers were the United Nations Children's Fund, UNICEF, the United Nations Population Fund, UNFPA, Nutritional International, the World Food Program, WFP, the United Nations Entity for Gender Equality and the Empowerment of Women, and the World Health Organization. Consolata Chibalonza reporting for EBN TV.
Well, now on to sports. Kenya finished at the top of Group A in the Sekafa Under-18 tournament after defeating Somalia 4-1 in a match played at the capacity-filled Bohungu Stadium in Kakamega County. Now, the result means that the Junior Stars have claimed 9 points with 10 goals from the 3 matches and will now face the runners-up from Group B in the tournament's semi-finals. Now, Salim Babu made several changes to the team that faced Rwanda in their second group game, which was played at Jomo Kenyatta International Stadium in Kisumu on Tuesday. Aldrin Kibet and Tryon I will be taking that again. Tryon Kariuki started from the bench as the Star looked to finish at the top of the standings, as they had already qualified for the semi-finals. Well, that right there marks the end of EBN Weekend Edition tonight. Many thanks for tuning in once again. My name is Samia Dika. Do have a wonderful weekend.